Okay, everyone, we are live. So welcome to our media briefing for Wednesday, April 29th. Today we will hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, and then we'll have an update from Regional Chair Karen Redman, followed by an update from Regional Waterloo CAO Mike Murray. We'll get started with an update from Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Thank you, everyone. So overall, sadly, we continue to see COVID-19 deaths in our community. To date, 67 people have died in our community. I wish again to express my deepest condolences to all the families, loved ones, friends, and caregivers of those who have lost people to COVID-19. There are currently 12 long-term care home or retirement homes in outbreak. We continue to work closely with facilities in outbreak, and with the continued close monitoring and expanded testing, I expect to see more cases identified. Finally, I am pleased to share that 285 people have now recovered from COVID-19 in our community, and 10 facility outbreaks have been declared over. As the days start to get warmer, I'd like to remind all residents of the importance of following the public health measures. I know this is a challenging time and many are feeling isolated. But staying home, limiting how often you leave your house, and practicing physical distancing is making a difference. These measures help slow the spread and ultimately help save lives. Your actions are making a difference. Finally, I want to express my sincere gratitude to staff at long-term care homes, retirement homes, and other congregate settings across Waterloo Region. The work you are doing is exceptionally challenging. But this is crucial work, and the compassion you are providing is invaluable to those that you care for, their loved ones, and our community as a whole. Please know that your work is truly appreciated. Thank you for your commitment and service. Thank you.
Thank you, Dr. Wang. We'll now hear from Region Waterloo Chair Karen Redman. Go ahead, Karen.
Thanks, Julie. It's hard to believe that we're in week 7 of practicing physical distancing. Collectively, our efforts are working to slow the spread of COVID-19. We are making a difference and we are seeing some promising signs. Yet I cannot emphasize enough that COVID-19 is still in our community and especially impacting long-term care and retirement homes. We continue to identify new cases each day, and the risks of contracting the virus still exist throughout the region. Today, the region of Waterloo and all area municipalities have extended the public closure of municipal, administrative, and operation facilities until at least May 31st. This decision aligns the municipalities with Sunday's announcement from the provincial government delaying the reopening of the province's schools until May 31st. Earlier this week, Premier Ford announced a provincial framework for reopening the province. It's a high-level outline of how government plans to reopen businesses, services, and public spaces. There are no specific timelines for these plans, as we're not yet at the point where it is safe to implement them. In Waterloo Region, a safe and effective reopening plan must continue to include our public health measures until we're sure it's safe to relax them. Together with our municipal and community partners, our back to business plans are in the works, but they're slow and cautious. In the meantime, we continue to provide emergency and critical services that will keep the community safe and running smoothly. As always, we make our decisions based on the guidance of Dr. Wang and our public health team. As the weather gets warmer and as we approach celebrations like Victoria Day, Mother's Day, and Father's Day, remaining isolated will become increasingly more difficult for all of us. We all want to get back to enjoying gatherings with our family and friends. These isolation measures are a marathon we're running as a group, and we must all cross the finish line together. If any of us stop running and cheat on isolation, it will send all of us back to the starting line. And as a community, we can't let that happen. Hang in there. I know it's tough, but it is important. Don't undo all the work we've already done. It's working. A little more sacrifice now will bring us back together sooner. Thank you.
Thank you, Karen. Okay, so finally, we're going to hear from Region of Waterloo CAO Mike Murray, who will provide an update about the region and area municipalities' decision to extend public closures to May 31st, as well as an update on monitoring and compliance. Go ahead, Mike.
Great, thanks, Julie. I'm probably just going to repeat a little bit of what Chair Redman just said about the facility closures being extended to May 31st. So that applies to all regional and municipal administrative buildings and operation facilities. We had previously announced those closures would go until May the 4th, and we're now extending them until at least May 31st. Some area municipal facilities, they've already announced that those facilities will be closed until the end of June. And so you'll recall that from a previous communication. So that included parks, recreation facilities, municipal libraries, things that needed a very long lead time to notify users and also need long lead time for reopening. But region and area municipal administrative and operation facilities closed to the public. And I want to emphasize closed to the public until May 31st. And I would say this decision, it aligns with the provincial announcement of school closures extended, but more than that, it was informed by the framework for reopening Ontario that the province released on Monday. And if you look at that carefully, that framework really describes a slow and gradual plan for reopening Ontario. And some of the specifics, the province talks about some of the factors that they will consider prior to easing restrictions. And so some of those factors that the province will consider include a consistent 2 to 4 week decrease in the number of daily COVID-19 cases, a decrease in the rate of cases that cannot be traced to a source, a decrease in the number of new cases in hospital, and the ability for public health officials to reach approximately 90% of new COVID contacts within 1 day. So that's some of the conditions that the province will look for before they start to ease restrictions. And I would say probably few, if any, of those conditions are currently met. So that says to us, it's going to be a little while before those conditions are met. Once they're met, then the province described a 3-stage process for reopening the province. It's a little hard to tell from the framework where some of the local, municipal, and regional facilities and programs would fit in those stages. It looks to us like they would mostly fit in stage 2 and stage 3. The province also said that this gradual incremental opening up, each stage would take about 2 to 4 weeks. So when we put all that together and said they haven't yet met the conditions for reopening, once they start to reopen in a sequential way, it's going to be 2 to 4 weeks per stage. All that said to us is it's highly unlikely that we'll be able to open to the public much before May 31st. Having said that, we are working on our reopening plans. And if we are able to incrementally bring some staff back into some of our facilities in advance of May 31st, we will absolutely consider that. And if the province provides direction that allows us to incrementally open some facilities in advance, we would also consider that. So that's kind of an overview of some of the thought behind, where May 31st came from. It wasn't just, oh, that's the school closures extended. There was actually considerable amount more thought went into it to try to align with the provincial framework. So that's one update I wanted to provide. The other update, we said we would provide weekly updates on Wednesdays about monitoring and compliance. And so I'm going to give you the cumulative totals to date. So this is probably adding on to what I gave you last time. So it's cumulative totals. Total number of site visits that involved either education warnings issued to people, 1,061. Total site visits where no action was required, either enforcement officer got there and there was no activity, or the activity was in compliance with guidelines. So total site visits with no action required, 479. Phone calls, 687, and a total of 6 charges laid, which I think is one more than we listed last time, which was 5. And I think that additional charge is, I think it's a tattoo parlor. It's either that or a residential property. We'll have to check on what we listed before, sorry. So the total number of complaints and or sort of compliance and monitoring activity to date, 2,242 contacts by phone or in person. So those are my updates, and I think all of us are happy to answer any questions.
Thank you, Mike, and thanks to all of our presenters. We'll get over to your questions now, our media partners, and we'll start with Irene from Air News. Go ahead, Irene.
Thank you. My first question is for Dr. Wang. Of the active cases in Waterloo Region, how many positive cases are from long-term care home and how many are not?
Okay, so I'm going to go on to our dashboard to take a look at that. So if you go onto the dashboard, I think you should be able to see I don't have the active cases yet, but overall, all the cases, taking into account all the cases, 60% of them, 439 of them have been related to long-term care home and retirement home outbreaks.
So does that mean cumulatively? So as of today, we don't have a figure?
No, as of today, we have, of all the cases confirmed in the region to date, 60%.
No, I was looking at how many are active right now. How many people with COVID right now in the public have COVID positive, and how many in long-term care homes are COVID positive? We don't have that figure?
I don't have the active figure. I just know that the active figure is taken overall in the community. It is subtracted. I'm sorry, if you take the number of positive cases on our dashboard and you subtract the number of resolved cases, that gives you the number of active cases, but I don't have that breakdown by setting.
Okay.
Yeah, we're working on it, but we don't have it yet.
Okay, I guess that would lead into my question I have for Chair Redman as well. Depending on that figure, I mean, if all of the cases are contained in long-term care homes, there would be less danger to the public. Because
I might try to answer some of that, and of course, Chair Redman can jump in, but they're connected. The cases in long-term care homes do come in from the community. If there are people like healthcare workers that are that become infected as part of a long-term care home or retirement home outbreak, they do then go out into the community, although they are subject to self-isolation like other cases would be. And so the two phenomenon, the wave of cases in the community and the wave of cases in homes are linked, and it's still a significant risk for our community because we are still we are still detecting cases in our community, even though that has slowed down. So I'll leave it to Chair Redman to add anything she'd like.
Sure.
That.
Sorry. I guess again, I'll leave it alone, but it's knowing whether or not the long-term care homes are circulating the cases amongst themselves as opposed to being brought in off the street. I was just wondering, that's what I was wondering about, but I understand what you're saying.
So Irina, if I can just add a little bit, there are all kinds of frontline workers, first responders, and people who are providing service through the region and through hospital system that are self-isolating because they don't want to take that back to their family. But the reality is there still is community transmission, albeit the good behavior and following the guidelines of public health have helped. But it creates a risk for those people who are delivering those services who are out in the community. And the reality is we do see cases of COVID-19 throughout the community. The long-term care homes and retirement homes are clearly a hot spot, but they're not the only place and the only way that people are still contracting COVID-19. So the risk really is throughout the region, which is why we really are prevailing on people to continue to use physical distancing and recognize that that risk is throughout the region in the community.
Okay, thank you. Chair Redman, does Waterloo Region have to follow the directive of the province as far as any gradual reopening? Does that, do you have to have permission of the province, or if Waterloo Region, say, was declared very low risk, could it open anything ahead of what the province says?
So I guess I'll answer it this way, and I don't know if Mike Murray wants to jump in. I would tell you that as somebody who declared a state of emergency along with my colleagues in all the area municipalities, that was not done lightly, and that we will continue to be compelled by the guidance of public health before we make any of those recommendations. And I absolutely subscribe to the slow and gradual reintegration and loosening of those physical distancing rules. I think it's really important that we continue to stay vigilant and recognize that there's lots of talk about a second wave and a third wave, Irene. So we have to move forward carefully and recognize that having staff come back to manage some of the facilities that they have not been at work or working at home, they're without childcare right now. So we have to be thoughtful in how we reintegrate this. So it's not going to be like flicking a switch and turning things back on. So the decisions that we're making mirror the provinces, but it's really because it's the best course of action. I don't know, Mike, do you want to jump in?
Yeah, I completely agree with everything Chair Redman said. I would just add a couple of other pieces, which is, recall, we're under a provincial state of emergency. And under that provincial state of emergency, the province has issued a number of emergency orders. And it's these emergency orders, so this is restricting public gatherings to less than 5 people, closing bars, restaurants, places of worship, childcare centers. Those are all specific emergency orders that the province has issued. So, and those are enforceable. So Irene, to your question, we must comply with those. And so until those are rescinded or changed, we actually have no choice but to comply with those. And I think it's quite possible that what we'll see over the next weeks is the province issuing new emergency orders that perhaps start to relax a little bit of what's in the current ones, but they will be equally enforceable. We'll have to wait and see. how the province structures the reopening, but given the last 6 weeks where the province has basically acted by emergency orders, I'm imagining that that's what we'll continue to see, and the region will need to comply with those.
I just have one more quick question for Mike. When you talked about 687 phone calls, what direction were those phone calls? Is that the public calling enforcement, or is that enforcement calling the public?
No, I believe those are calls received by our Service First call center and the public health call center. So these are people calling in with questions or concerns or complaints, and those are calls that are able to be answered on the phone without having to dispatch somebody to go out and do a site visit.
Great, thank you, that's it.
Okay, thank you, Irene. We'll move on to Joanna from the Record. Go ahead, Joanna.
Thank you. Couple unrelated questions probably. And probably for Dr. Wang, is the region still doing contact tracing, or is that something that's going to be picked up again?
Contact tracing is something we've continued to do, but we are focusing on the close contacts, the ones that are really at significant risk potentially of contracting the virus from a case. And it's one of the priority things that we continue to do.
And so close contacts, like some places are using apps now to do that. Would that be something that the region would consider?
We need to be sure of the information that we obtain. So we, we also have to make sure that we comply with any privacy laws. When we reach a contact, for example, we need to speak with them and give them public health advice. It's one of, we're still using the measures that we feel are what we need to use in order to make sure that we connect with cases and contacts and are able to exchange information with them and answer their questions and things like that. So we're not using any apps at this point in time.
All right. And then wondering about the modeling that you guys released earlier that projected 66 deaths by the end of the month. Now we've just passed that. Do you feel good that you were pretty close, or are you concerned that there's still a few more days and that we could jump past that substantially?
No, thank you for your question. I have to admit, I was hoping we wouldn't even be close. And when I gave that prediction, or a modeling, rather, I shouldn't say prediction, it was a modeling forecast based on the provincial model. We had very low numbers at the time, but it significantly grew in the last 3 weeks since then. And the majority have been in long-term care homes and retirement homes because of the outbreaks there. So I was quite sad to see that we were approaching and now have slightly, surpassed that very rough number. Was just to give us a scope of an idea of the potential magnitude. I think it just illustrates that we are still in the thick of it when it comes to long-term care home and retirement home impacts. And so sadly, we are relatively in line with what was projected in terms of deaths.
All right, and just
I meant to mention, so the province is going to continue to do modeling and update their modeling, and when they have updated information that we can use, I understand that will also be a very significant informational input into the province's plans in terms of reopening. And when we get that, we'll be able then to extrapolate to our region again, but we don't have that yet. but that's another thing I think is very important in terms of the provincial plan for reopening. The province does get our information. We feed up information to the province every day. They take that into account in terms of their strategy for reopening. They have the experts, such as the provincial modeling experts, that can give a much better sense to all of us, including local public health units who don't have that expertise, to be able to say, you know, overall, do we think this is the time to start relaxing measures or not? So that's also another element that we, another input that we have to await for from the province. Thanks.
Is there a timeline on that, the new modeling? No?
Why, no. We often get it at the same time you do.
Okay.
And we get the same materials you do.
All right, fair enough.
Yeah.
And then just last question. You mentioned a previous the antibody testing and how that would be used in a couple months in studies. So were you saying that that would be like sort of done sort of in an academic research setting versus the province or local public health?
No, that's a great question. I think it's something that will be led by the province. And, you know, honestly, we are really focused on our local priorities and responding to local needs that honestly, I don't think we would be able to participate actively in a research project that wasn't led by the province in a way that, we could, potentially participate, but that they would have to lead because we wouldn't have, the expertise nor the capacity at this point to sort of take on leadership of a research project in the midst of responding to the outbreaks and cases in our region. We have to put priority on the outbreak management and on the case and contact management and on activities such as, supporting the collection of data, the analysis of the data in order to demonstrate local trends, as well as things that, you may be aware now, we are also involved in, along with other health system partners, to try to address some significant challenges in long-term care and retirement homes, for instance, as a sector overall. So we're focusing on those things.
All right, that's great. Those are my questions.
But I also hope to hear soon about whether there'll be serology testing coming in the coming months.
Okay.
Okay, thank you, Joanna. Nicole, we'll move on to you, Nicole from CTV.
Hi, good morning. This morning, we're seeing the village at University Gates announce their second outbreak because it was previously closed. I'm just wondering, with expanded testing at long-term care and retirement homes, how often would a test be done to still be identified those newly infected? Like, how long do you have to wait to test again? And is there any data to suggest how many false negatives you get in a population?
Now, thanks for those questions, Nicole. So we're filing provincial guidance, which has tightened up, successively over time with respect to, who to test, when to test. And I'm actually glad, I don't mean I'm glad, but I'm actually glad that the additional case the new case in a staff person was detected. That home did everything it needed to go through its first outbreak. They continued to put in place very active monitoring measures, and then a staff person again was detected. And now with the very strict definition of what constitutes an outbreak, which is just one person, now they are going to go back in outbreak. That means they're going to go back into enhanced measures. That means there's going to be more testing as a consequence. But what I think that highlights is a very robust monitoring system for ensuring that the minute we see any evidence of something potentially coming back into the home, we can put in place actions.
Does this mean then the residents who were tested before, are they going to be tested again?
It depends. It's not a simple blanket situation, but homes in outbreak, yes. the residents and staff are generally tested, although they'll be tested in priority order, right? So it's not necessary. It depends. Homes can be very large. They can have a couple of hundred residents and even more staff. And so, depending on where the case was located, you would start with that unit, for example, first, and you would expand to the rest of the unit. But yes, homes in outbreak generally have whole home testing.
Okay, that leads to my second question. I saw a home, and I hope I don't butcher the name. I believe it's Sunbeam Village, and that includes children as well at that facility. So I'm just wondering, do the children qualify for the long-term care testing, because it is an outbreak situation?
No, it's a great question, and yeah, we understand there's that home has a mix of, like, it's partially a long-term care home, partially a group home, and so it's on our list. But yes, the way that we are treating homes in our region, whether they're under a provincial directive or not, and some are not because they're not long-term care homes and retirement homes, and to date the provincial directives have only applied to them. But for us in Waterloo region, for our public health unit, we are providing the same types of supports to the other types of settings that are congregate in nature and that have vulnerable populations. And so, for example, we would treat the management of cases in this home the same way we would treat the management cases in a long-term care home or retirement home. So yes, we will be doing extensive testing at this home.
Okay, thank you. And one last question. I think it has to do with Chair Redman may be able to answer this one, since you are also the chair of the police board. Last time you spoke with us, you talked about the PSA about domestic violence. It's on the rise. The question is, can you provide an update? Is there enhanced wraparound service for those who police can identify as going through a domestic violence situation in this COVID situation?
So I guess, Nicole, the best answer that I can give you is those wraparound services that are in place normally are in place, so that anyone calling the numbers that we shared with you last time would receive that level of service. So those are looked at as essential and continue to be in place.
Okay, thank you. That's it.
Okay, thank you, Nicole. We'll move on to Kate from CBC. Go ahead, Kate.
Hi, thanks. I think I'm going to start with Mr. Murray. Good morning. In the release today, it talked about libraries and museums, and it said that the city municipally run libraries are going to be closed until the end of June, but the region's libraries and museums could open as soon as May 31st. Why is there a difference between city libraries and regional libraries?
Yeah, that's a good question. So to some extent, I guess you'd have to ask the cities. One of the differences is several of the city libraries are co-located with recreation facilities. And the recreation facilities are closed until the end of June. And there's a whole bunch of reasons for that I think have been explained before, and I think you all understand, which is the users needed long lead times. They needed to know whether spring recreation programs were going to take place. They're not. And then the other thing is the cities need municipalities need long lead time to get those facilities back in a usable order. So even when things open up, they've got several weeks worth of work to get a swimming pool or a playing field back in usable order. So that, I think, was part of the consideration, was the co-location. And then I think the other thing was the cities looking at if they were extending all their parks, rec, all those programs and facilities until June 30th. For consistency within the cities, I think they extended museums and libraries as well. Whereas the region, we're looking at consistency with other regional programs and facilities. And that's why we had them closed until May the 4th. And now, consistent with other regional programs and facilities, we're extending that until May the 31st. Again, subject to the guidance from the province about reopening and what things we're able to reopen and when and how.
Great. And Mike, on last weekend, I saw Cambridge tweeting out, don't congregate in parking lots. Is that something that's happening across the region where people are gathering in parking lots and sort of sitting in their cars to chat?
So I think there's a couple things going on with parking lots that the area municipalities are on top of, and I think local bylaw is monitoring carefully. So one is, Kate, I think the scenario that you described, people are going to a parking lot, either sitting in their cars or, like, frankly, I've driven past parking lots where a bunch of cars parked and people standing beside their cars, having a chat. So that's one thing. The other thing that's going on is people are driving to parking lots at parks and trailheads to use parks and trails. And that creates congestion in the parking lots at the parks and trailheads, which is why actually some of the area municipalities have closed parking lots that are heavily used at area municipal parks and trailheads. And they've posted signage that these facilities are closed, and they continue to reinforce the message, stay home. If you feel you need to go out for your physical and mental health, stay in your neighborhood. Don't go driving to a parking lot at a park or a trailhead. So that's what's going on, I think, with parking lots.
Okay, and this is a question for Dr. Wang. Toyota is set to reopen its facilities on Monday with workers coming back. We've received a number of emails from people who are concerned that they're not doing enough. And I'm wondering what role public health has in helping Toyota get sort of back to bringing people back into the factory in Cambridge, if any role.
That's a good question. So public health units do not have a mandate for workplace health. That said, if there are situations where there could potentially be an outbreak situation, we would be able to work with Ministry of Labor, for example, in taking a look at the situation. But sometimes there are people in the workplaces that are detected, especially now if they are part of the essential workers group. They have access to testing. They may test positive, but it doesn't necessarily mean there is a problem at the workplace that's leading to an increased risk for workers. So I would say that the oversight for workplaces remains with the Ministry of Labor. Public health can support in situations where there may be evidence that there could be an outbreak in that workplace. But if workplaces want to sort of have their plans for reopening looked at, I would suggest that they consult with the Ministry of Labor.
And then I just have one more. We're talking about these retirement homes and Sunbeam needing to have, everyone tested, and potentially at University Gates, everybody tested again. It's my understanding these tests are really unpleasant, and you don't really want to have one. But how are people handling that? Do you have a sense from the people who are going in, the assessment teams, like how people are handling having these tests done that are really uncomfortable?
Yeah, it's called a nasopharyngeal swab. It is unpleasant. And, it's quick, but it's unpleasant. From what I understand, from what I hear from time to time, healthcare workers are trying their best to do it with care. And they understand that it's not a pleasant test to have, but it's important. It's the test that's recommended. And our understanding is that it's a test that still has very good, what we call in science, sensitivity and specificity. So it's still a very good test. And it's the best way to get good results.
Okay, I'm done. Thank you.
Thanks, Kate. Damon, we'll move on to you. Damon from Woolwich Observer.
Hello, I'm going to start off with a question for Mike Murray. With the announcement of opening of essential community gardens, how will these be enforced to ensure not excess amounts of people are coming to these facilities? And is there any update of when they will be allowed to open?
Yeah, so Damon, really good question. You'll have seen, the province allowed community gardens to reopen, subject to receiving advice and guidance from local medical officers of health. And I know, and Dr. Wang can comment on this, I know that the public health team is working really hard on getting those, the guidelines issued. I think they had a meeting as recently as yesterday with the local community garden council, because they want to work closely with the organizers and users of community gardens to make sure that the guidelines are protective of public health and yet are kind of practical. So they're working hard on that. And I believe, subject to what Dr. Wang says, I believe they're hoping to have those issued by the end of the week. And so once those are issued, then I think that opens the door for organizers and users of community gardens to open them up. And in terms of enforcement, monitoring and enforcement, the monitoring and enforcement would be the same as every other order, which would be a combination of, likely in the first instance, these would be local bylaw officers, potentially supported by public health inspectors, regional bylaw, and in the extreme, Waterloo Region Police. Like those are the four groups that are doing monitoring and enforcement. And the data that I give you every Wednesday is a compilation of local bylaw, regional bylaw, public health, and Waterloo Region Police. Hope that helps. Hsiu-Li, do you want to add anything in terms of timing?
No, what you said was right. We're working as fast as we can.
Yep, we'll get there.
Is there any worry about just large amounts of people going, because we're supposed to be keeping social distancing? And then maybe for Dr. Wang, any preventative measures when they're out, because a lot of people who will be participating are elderly and are vulnerable and at risk, right?
Well, there is still the provincial emergency order limiting gatherings to no more than 5 people, unless they're part of a household that has more than 5 people. And so, those are still the orders that we all have to comply with. And it's possible, in future weeks, as the province begins to relax some measures, if we're able to, that gets modified. But until that time, the gardens, like other places, would be subject to the same orders as well as any local guidance that we could provide.
Okay, perfect. Thank you. My next question is again for Mike. With these recent birthday parades and parades to visit frontline workers, are we worried about extra congestion in the streets? And these aren't essential trips out of the house. Could you touch on that?
Yeah, that's a really good question. I agree. They're not essential trips. I would say, given the current state of traffic, we're not overly worried about congestion. Anybody who's been out and driven around, traffic is significantly lower than usual. So no, I don't think we're worried about congestion. And typically, my understanding of these is, people. So they're not necessary trips, but they also don't have a destination, right? Like people are going out of their house, getting in their car, participating in the parade, going back to their house, going inside. So, it's not great, but I think it does serve a useful purpose. And, it's this tricky balance between, encouraging people to stay home and also recognizing the social needs that people have. And so to me, I'm giving you my personal view. This would be one of those things that is a really low risk undertaking and probably is helpful in terms of just some psychological well-being, both for the participants and for the people who are being recognized, whether it's somebody's having a birthday or frontline workers.
Okay, great. And then just one last question. You mentioned the tattoo parlor, but you already mentioned one the other week. So
Yeah.
you think this one's the residential?
Yeah, so you know what? It is. Yeah, I had that
Okay.
confirmation while we were on the call. It is, I think I had said previously, we had a nail salon, tattoo parlor, one residential property, a vape store, and the basketball players.
Yeah.
This one is another residential property, people congregating in a residential property in Cambridge.
Okay, perfect. And that's all my questions. Thank you, everyone.
Thanks for the clarification.
Okay, thank you, Damon. Ben, it's your turn. Ben from 570.
Thank you, and good afternoon, everyone. This is a question for Chair Redman and Mike Murray, I'm not sure who. When the vaccine actually is developed, if it's not mandatory for all Canadians, will it be mandatory for municipal employees?
Over to you, Mike.
Yeah, so you know what, Ben? So I'm going to not speculate on speculative questions. Like, there's actually many speculations in your question. A, we'll get a vaccine. B, will it or won't it be mandatory? And C, what will we do with municipal employees? So you know what? There's a lot of bridges to cross there, and we'll cross each of them one at a time.
And if I can just add, I mean, should there be a vaccine, one of the things that public health currently do in the region does is allow clinics for people to go and get the inoculation. So we're always looking at the greater good. So a lot of those speculations can't be answered at this point in time, but clearly would facilitate good public policy through public health.
All right, I'll be sure to ask that question later then.
We'll look forward to that.
All right. I have a second question here. So we do have word from the province that, and we actually got this email last night, that vigorous screening is in place for agency nurses visiting retirement homes. We did have an agency nurse and a couple of other employees reach out to us who said they're still visiting several homes in a day, some of those in outbreak. So who is the onus on to make sure that that screening is getting done? Is it the retirement homes, the agency, or is it up to the province to put in a rule that those nurses can't visit several homes in the same day?
Hi, Ben. Thanks for your question. So the province put in an order, a provincial order with respect to movement of employees of long-term care homes to other long-term care homes or similar types of settings, I believe. Whether or not that excludes agency workers is actually something the province will need to answer.
They did answer it. It does exclude agency nurses.
So it excludes the agency nurses. And so that's the extent of the provincial legislation. Screening, as you mentioned, is mandatory before anyone goes into any of those homes. And that is the responsibility of the homes to ensure.
Okay, so the onus is on the homes. All right, that's all my questions. Thank you.
Okay, thank you, Ben. And that's it for questions. Kevin let me know through the chat that he doesn't have any further questions. Does anyone, we'll just circle back one more time and see if you want to raise your hand if you have another question. Hi, Nicole, go ahead.
Hi, there's been a lot of talk about concerns at meat processing plants internationally, not just here in Waterloo region. Wondering if there are any special protocols being put in place because we know of, you know, the concerns at Conestoga meats.
Well, thanks for your question, Nicole. So for those types of workplaces, you know, it's something that the Ministry of Labor, and in the case of Conestoga Meats, the CFIA have a lot of involvement in. You know, they provide the oversight for those places, and we work closely with them when there are questions about you know, cases in those facilities. So we have been in contact with those agencies, and there are very thorough requirements that workplaces such as Conestoga Meats has to put in place in order to, you know, minimize the chances of an infection like COVID being spread in those workplaces. And they are overseeing that. And what we see speak with them is that they're very strict. And in addition, for example, the Canadian Food Inspection Agency, they actually have inspectors on site. So for a place like Conestoga Meats, there are many inspectors that are actually physically on site, also monitoring. So yeah, there are a lot of measures being put in place for those workplaces. That's what we're aware of. Yeah.
Okay, that's
Okay, anyone else that has a question? Seeing no more hands, we will conclude today's media briefing. Thank you everyone for participating, and we'll see you back here on Friday. Take care and be safe.